Madhu? Hi.
ಮೇಡಮ್ ಒಂದು 1 hour ಬಿಟ್ಟು ಕಾಲ್ ಮಾಡಿ.
Good morning, everybody. Welcome to NAPSI Ayurveda and Cosmetic Center, Skincare, Hair Regrowth and Weight Reduction Center, where Ayurveda Panchadharma, Cosmetology, Trichology are under one roof. Today, the topic is female infertility, that is vandhyatva. This is exclusively for PMS doctors and Ayurvedic students, not for non-medicals. So, the viewers, if you are having any gynec related problems, either PCOD or menstrual disorders or any infertility, you can post your queries in the chat box. Or else, you can call to the number which is scrolling on the screen. So, let us come to the topic. Vandhyatva. According to AIMS, about 10 to 15% of couples in India are said to have infertility issues. It is maybe due to late marriages, stressful lifestyle and working patterns, obesity, or more intake of junk food and smoking, alcoholism, drug addiction contribute to the problem. As you all know, to get the normal pregnancy, female partner should have a healthy uterus, healthy ovaries, and open fallopian tubes without having any blocks, and capable of producing ovum and normal sperm count and motile sperms. Many concepts and methods are introduced in the allopathy, but they're not free from the side effects, right? In Ayurveda, we can manage this condition with balya drugs, brahmana aushadhis, rasayana, and vajikarana dravyas. They are used effectively in improving the sexual wellness and without any side effects. Today, Dr. Supriya is with us. Further details will be given by our guest speaker. Let me give a brief introduction about her. Dr. M.supriya, working as a professor in SJG Ayurveda Medical College in the Department of PG Studies, Koppal. She has teaching experience of 13 years and guide for 12 PG scholars, presented papers both in national and international conferences. To name a few, Saushruta 2007 International Conference of Shelya, Shalakya, Prasuti Tantra, State level conference on anesthesia at Ashwini Ayurvedic Medical College, Davangere, and other webinars in the last pandemic. Hi, Dr. Supriya. Welcome to our channel today.
Me. Thank you.
And the viewers get maximum benefit out of it. And your suggestions and comments are most welcome. So watch the video till the end. If you are having any queries, just comment in the section and subscribe our channel to get notification in the future videos. So I hand over the session to Dr. Supriya. Please start your session.
Very good morning to the listeners and viewers. Myself, Dr. Supriya, working as a professor in SJG Ayurveda Medical College, Koppal. And today I am here to present a topic before you on female infertility, that is vandhyatva, what we call in Ayurveda. Introduction. The desire of children is usually stronger than self-interest in beauty and figure. It may be stronger than the claims of career. Childlessness may be a tragedy for a married woman and can be a cause of marital upsets. I hope I'm audible, Dr. Srilakshmi. Dr. Srilakshmi, am I
you are
audible?
audible.
I'm audible. Yeah, Thank you.
Yeah, you are audible.
Yes, madam. Thank you. Childlessness may be a tragedy for a married woman and can be a cause of marital upsets as well as personal unhappiness and ill health. And it is once and still in certain communities it is regarded as a displeasure, and it's a ground for suicides. And nearly around 10 to 15% of marriages prove to be childless these years because of the uncongenial diets which is followed, which we'll be dealing in the further slides. So before we could go to the topic proper, let us see what are the factors needed for the conception, which have been already explained in our classics thousands years ago. It said after the age of 16th year, that is once a girl uh, after her she's puberted, and with the normal cycles it nearly takes 2 to 3 years to establish. That is from 16th year onwards there will be Shuddha Arthava and Shuddha Shukra, that is Shuddha Garbhashaya Marke Rakte Shukra Anile Hridihi Viryavante Suto Suto Sudam Sute. So, for a proper, an ideal conception to occur, there should be a Shuddha Artava and Shuddha Shukra, and Shuddha Yoni Marga and Shuddha Garbhashya. And only then the conception can be a fruitful. And we do have another reference stating that Dhruvam Chaturnam Sanidhyat Garbhasyat Vidhi Purvakam Ritukshetra. Hello? Hello? Am I audible? Hello?
Yeah, you
Ritukshetra.
are audible. Please
Yeah,
carry
yeah, yeah.
on.
Yeah, yeah. Ritak Kshetra Ambu Bijanam Samagyat Ankurodhatha. Here, this is the reference that gives entire anatomical and physiological changes that takes place in a body and thereby yield to the conception. So here the Ritu in the commentary, the Lalhana comments, Ritu Ranga Raja Samaye. So that indicates Ritu is a time, or Ritu is the definite time when the seed is sown. So here we can take it as the age of the couple also, and also the phase of the reproductive cycle, that is the ovulation period. Okay, so this ovulation period usually occurs between 14th to 16th cycle depending on the length of the cycle. And hence, so Rutu, it and also it is important the age of the couples, the age of the couple, and that too the women aged between 20 21 to 30 33 years are said to be the more fertile age. And later on, though we do not say it is infertile, but the quality of ovum goes on do decline after the age of 35. And the next is the kshetra. Kshetra garbhashaya. Garbhashaya, it refers to the uterus, which is devoid of any congenital abnormality, or like we can say there is any uterus diadal phase, or arcuate uterus, or a heart shaped uterus, or unicornuate uterus. You can see it is a single horn, and bicornuate uterus. You can see two bodies, uterine body, and the septate uterus. You can see the uterus is divided by a septa, septa, longitudinal septa. So this such, if any congenital abnormalities, if it is persisting, or if it is acquired, or we can say if there is any local lesions, like if there are any fibroids or mucosal polyps, if at all is there, if the kshetra or the place where the seed has to be sown is any, it is deceased, then also it is a threat for the normal conception. So this has also been told in our classics, that is Rutuk Kshetra Ambu Bijanam, which is only if all these four entities are said to be normal, only then the Garbha can grow appropriately. Next is the Ambu. Ambu here, it refers to Punarahara Pakajo Vyapi Rasadhatu. So here we can say that Ambu, it is the Ahara Rasa, whatever the Ahara which is taken by the mother, if it is get properly digested, and the Ahara Rasa which is taken, it should be Ushna, Lakhu Ahara, and Snigdha Karahara, and Ekarasa Pradhana should not be there, Shitrasa Yukta Ahara, and whatever the ahara vishesha ayatanas which are explained in the classics, if they are followed, and then such a food, if a woman is taking, then the properly formed rasa dhatu will help in uttarottara dhatu poshana, and thereby it leads to a good endometrial thickness, we can say. So this endometrial thickness, whatever we say, the endometrium which needs to be normal in the secretory phase, we can say the priming of the uterus is very much important in patients with infertility. So this takes place if the ahara rasa is properly formed, and thereby the should the arthava lakshanas will also be there. Here we cannot take it as arthava as just the menstrual blood. Here the arthava refers to almost the entire interplay of the hormones, we can say the HPO axis, or we can even say take it as the ovarian hormones. So it all, depending on the context, we have to take what the arthava means. So here ambu, it is the punarahara pakacho vyapya, that is the priming of the uterus, that is a prior to the implantation, that is the good secretory phase is very much important for the proper implantation. That is the significance of ambu. Next is the bija. Bija, it refers to Stri Pumsayor Arthava Shukre. Here, the bija, it refers to the normal sperm and the ovum. So, which is devoid of any morphological abnormalities, or which is anatomically normal, or that is one morphological. It should not possess any of the abnormal head or the neck or the tail abnormalities, or any other. It should be a normal sperm. That means it should be a healthy sperm and a healthy ovum. That indicates the bija. So these are the four entities which are very much necessary for the normal implantation and continuation of uneventful pregnancy. So what do we see in the modern parlance is, in the modern parlance we have, uh, of course, the infertility is it applies to both male, 50%, 40% male contributes, and 40% female contributes for this infertility, and nearly 10% is 20, nearly 10% where it becomes an unexplained infertility, and even sometimes where both of them contribute to this infertility. So, and to the male infertility, usually it is because of the compromised spermatogenesis, or it could be because of azoospermia. And coming to the female infertility, with the current topic which we are discussing today, it contributes to about tubal factors to 35%, ovulatory factors, ovarian factors nearly 50%, cervical factors, that is 5%, and about 60% it will be divided into the uterine factors and the pelvic factors. So now let's see what is the term infertility. It is the inability to conceive following unprotected sexual intercourse for a period of 1 year with an age less than 35 years, or inability to conceive following unprotected coitus for a period of 6 months if the age is less than 35 years, because of the increasing uh, age of marriage, because of the girls are more career oriented, or they are more towards the uh, good academic career. So in such a cases, the couple should not wait for more than 6 months if the age is more than 35. So now let us see what is the term Vandhya, how it is told in our classics. Vandhya nashtarthava chaturtushvapi chadyasu bhavanti anila vedana. Here the Vandhya, it is predominantly by the Vata dosha only. Bhavantya anila vedana. It is as per Shushruta's definition. Here Acharya says nashtarthava. Nashtarthava, it means it indicates towards the secondary amenorrhea like conditions. Like the arthava was present before, but in the coming days it is not seen that proper. That is Vandhya Nashta Arthava, indicating towards a secondary amenorrhea like conditions. So, in our according to Charaka and Ashtanga Sangrahakara, the Acharya says here, Yada hi yasya shrunitakya bijam garbhashinaste nivartakam bijam pradushyate yada vandya janeti. It is the bija dushti that leads to the defect in the garbhashaya bija bhaga, that leads to the vandhya. That is, because of the maternal defect of bija bhaga, bija, that affects the female fetus growing inside growing, and that is going to lead with that female fetus would have this congenital anomalies in the genital tract. Okay, that is, it is the bija dushti that leads to the defect in the garbhashaya bija bhaga. Okay, and thereby this is called as, then such a girl is called as bandhya. But and it also says this anupakrama, where is the, it, as it is a genetic, it cannot be treated, or it cannot be, we cannot say it is asadhya, we can say it could be a yapya also. And this is a picture showing the various causes of like uh, various factors or the various causes for the infertility. To the tubes, for the tubes, it can be any blockage or kinking in the tubes. It can be with the hydrosalping sometimes, or kinking, or some congestion in the tubes, or blockage in the tubes. And this is the uterine septum, if at all is there. That is the one more congenital abnormality. Of course, this is not a congenital uterine this thing blockage and all. It is the acquired one, and these are the adhesions because of the endometriosis and the fibroids. And this is the polycystic ovarian cyst you can see around the ovaries. So now coming to the age factor, as it is said that, and it is also, and where all do we find the references for Vandya? I have gathered all the references for it here. And it is said that the born child, if the woman conceives at the age of 16, or we can say teenage pregnancy, excuse me, the born child will be either Rugya Alpa Ayu Raniva Garbho Bhavati Nevacha. It can be Alpa Ayu, Abhagya Shila, or conception never occurs if at all. It's even if it is conception occurs, it would be an Alpa Ayu. And what are the factors which are necessary for the proper conception, or which are the things that needs to be avoided? That is the psychological factors, like तत्र आशित क्षुदित पिपासित भीत विमान शोकार्थ kridanya. So after such excessive eating, hunger, excessive thirst, the bhita vimana, excessive grief, anger, and who suppresses the urges, vegadharana, all these, in these conditions the conception does not occur. Okay. And now coming to the classification of Vandhya. The classification of Vandhya, we find many such classification as per different authors. So the classification of Vandhya, according to Cherka, that is Vandhya, Atraya says Vandhya, Apraja, Avandhya, and Sapraja. Here the Vandhya refers to incurable or congenital resulting to absolute sterility. And this apraja, here infertility in which woman conceives after treatment. Hence is referred as apraja. Avandhya. The word has been described by Chakrapani to the use of the word avandhya for the childless couple, but she would conceive but with delay. And sapraja, here it can be taken as a secondary infertility. So after the first child, the woman does not conceive. And next is, according to Rasaratna Samuchaya, we do find the types, 8 types: Vataja, Adivandya, Vataja, Pittaja, Kafaja, Sanipataja, Bhutaja, Daivaja, Raktaja, and Abhicharaja. And as per the Haritha, here Acharya has given 7 types of Vandhya. They're like never conceiving woman, which is absolute sterility, and during childhood, that is Garbha Kosha Bhaga, if there is any injury to the Garbha Koshasya Bhagatva Tatha Dhatu Kshayadipi. Dhatukshaya, if at all it is persisting. Jayante Rajagarphasya Sambhutischa Kadachanaha. So in these conditions, it becomes quite difficult. And Kakavandya, which is a one child sterility, Anapathya, Kakavandya, Bhavaccha Ekam, Anapatyam Dvitiyakam, Anapathya, which is we can say no child or just a primary infertility. Garbhasravi, where there is a repeated pregnancy loss, Tiyam, Khadita, and Mritavatsa. Mritavatsa, it is the stillbirths, and Balakshana due to loss of Bala. Leading all these are some of the classification as per the acharyas explained in our classics. And now coming to the Univyapats. Now, why I have explained Univyapats here is Univyapats, the 20 Univyapats, whatever is explained in our classics, it can be, uh, uh, it, uh, it can inculcate almost all the gynecological disorders which are prevailing today. So this Univyapats, which are ultimately when they are not treated will lead to Vandhya. It is also told in our classics that Upadravas, when these Univyapats are not treated, it is definitely leads to Vandhyatva. So here, I have listed few yoni vyapats where there will, which leads to, which are because of certain anatomical defects, or it could be because of functional defects or congenital defects. So with the anatomical defect, we can say one such yoni vyapat is the antharmukhi. Antharmukhi, we can say it is because of uh, uh, the the cervix is cervix moves posteriorly, and thereby it keeps away it will be away from the pool of semen, and thereby the ascending of the sperms into the cervix and then to the body of the and then inside the uterus becomes quite difficult. So this can be taken as the condition like a retroverted uterus. So in this retroverted uterus, the correction is by the postural defect. It is because of the postural changes after the intercourse. After the intercourse, the woman is said to stay in the Pavana Muktasana posture for a period of 2 to 3 minutes. So, like this, even in the Mahayoni, it is also where the cervix is descended, and also in cases with the Prasramsini. Here, the Prasramsini also, where the cervix is going to descend in the vaginal canal, almost it is touching the introitus. It could be with the Mahayoni, where it is complete procedentia, or it could be with the Falini, hmm, Falini, where it is the cases with the cystocele and all. So here, uh, here the conception becomes quite difficult. But with the Antarmukhi, it is still easier. But with these Mahayoni, Prasramsini, Falini, where the posture with the Kegels exercises, or with the we can say with the improving the vaginal tone, we can, or with a certain sthanika chikitsas which are told in the classics, like sthanika chikitsas which are told for mahayoni, or with the prasramsini, like yoni purana or yoni dhupana. All these will help in the toning the vaginal or the perineal muscles, and thereby it helps in the it helps in the conception. Or we do find certain univyapats where there is implantation defects. Implantation defects like in case of Vamini or Asruja. Hmm? Asruja, where what Vamini is where the whatever the semen which enters into into the uterus, it comes out by the sixth or the seventh day, huh? and thereby it leads to and thereby it leads to infertility. So in this condition, we can say it is a seminal effluvium condition. So we cannot deny the condition, like patients with if the semen after the intercourse, if the semen comes out after the intercourse, it does not lead to pregnancy. Just one spermatozoa is necessary for the conception. This we can take it as a conditions like luteal phase defects, or the progesterone is insufficient in supporting the early pregnancy, like that. And even the asrija, labde garbhopi sasrija. This condition also, it is the hormonal deficient which may lead to early pregnancy loss. And also there are other conditions like the same astrogen and lohitakshara and lohitakshaya. In these conditions where the only feature is the excessive bleeding, this excessive bleeding, it can be because of varied conditions. It can be either a primary or a secondary. And infectious or pariplata, we can say, or we can say take it as a PID, conditions with the PID, pelvic inflammatory disease, where the conception becomes quite difficult because of the clinical features, which where there is mild dull aching pain, or there will be mild raise in the temperature, or because of this PID there could be kinking of the uterus, or there could be what we can say blockage in the uterus because of the salpingitis. So these infection, whenever they are persisting, will lead to the infertility and nutritional defects like putragni and suchi mukhi. So these are they can be a constitutional also because of the suchi mukhi and all. But the suchi the ananam, that is the cervix, which is a pinhole os of the cervix, it can be dilated with the uh, certain certain procedures, thanika chikitsa, and also, and thereby it increase by increasing the cervical tone. It increases cervical by certain thanika chikitsa. This can be this can be changed. And then local defects like shushka univyapats, that also may lead to the infertility, or the women at the age of increasing maternal age, or who are at the verge of premature uterine premature ovarian failure, in them because of the reduced ovarian secretion will have this pushka or the dryness in the vagina. So these are certain yoni vyapats where infertility would prevail, or if when they are not treated at the right time, it will definitely lead to the infertility. And these are the other yoni vyapas like acharana, aticharana, atyananda vipruta, where it can be taken as a sexual incompatibility, or we can even say that when they are not treated, definitely this is the upadrava of yoni itye lakshane prokta vimshate yonir vimshatir nijagadaha yonir gadaha na shukram धारयेत् दोषे उपद्रतः तस्मात् गर्भेण गृह्णाति स्त्री गच्छेत् आननं बहु. Means it will, when they are not treated, it will definitely garbhe na grihnati, it will not do the dharana of shukra. And that, and in while explaining this, the acharya has told it will lead to gulma asha pradiryate, that is garbham na grihnati, means it will definitely lead to vandhyatva. And apart from that, it may lead to gulma asha pradirana, that is the rakta pradara, or astruktara, these conditions. Okay, so the treating the yoni vyapat is very much important with a proper uh, doshanusara treatment to be done, and thereby otherwise it will lead to the bandhyatva as explained. So when there is vitiation of yoni, there will be no garbhadharana. So this is the picture. Okay, and now coming to the modern uh, the common causes for the female infertility. Here, the female infertility is divided depending upon the factors, depending upon for the proper understanding and for the proper treating the patients. It is divided into ovulatory factors, or the uterine factors, or the cervical factors, or the tubal factors, and the pelvic factors. So each factor contribute to its for the normal conception. So coming to the ovulatory disorders, there are, that is the aging, as I said, the age is the most important. With the increasing maternal age, the quality of ovum or the cytoplasm, the normal oocyte development is uh, little compromised. And diminished ovarian reserve. Diminished ovarian reserve, it is because of the excessive stress, and women now are into all, and almost all fields where men were supposed to be. So that itself pose some amount of stress in her day-to-day activities, and that will definitely reflect onto the ovarian reserve, and thereby it leads to premature ovarian failure. And because of this, and even which leads to infertility and reduce AMH values. And also we can say the patients now with the improper food and lifestyle are now developing with the PCOS, which is a multi-systemic, uh, almost multi-systemic endocrine disorder, PCOS. And apart from the ovulatory cause, next to the tubal causes. So now when we are dealing with the ovulatory cause, let's see what are the investigations which are usually done for the ovarian cause. For this ovarian cause, that is the diagnosis of ovulation is most important. The patients when they come with the when they come with some problem, the proper history taking gives us the entire picture of the HPO axis, and how the hormonal interplay, whether it is normal or not, that can be ascertained. So this diagnosis of ovulation is very much important by asking the menstrual history. And also the hormonal profile whereby the serum estrogen, progesterone, and FSH and LH, their values need to be need to be asked for. Hormonal profile, which becomes necessary in case of infertility profile. And also the follicular study for to know the growth of the follicle. Whenever the for the let me show the picture. Whenever the ovarian induction are given, ovarian induction, or the for the to increase the number of follicles, to increase the number of follicles, there will be one such follicle will be recruited in each month, and that follicle starts growing, and that will and when these ovulation induction drugs like letrozole, clomiphene citrate, when they are given on the third day of the cycle, so there will be new, where one or two follicles which were to be recruited in a normal cycle, when these ovulation induction are given, there will be number of three, four, nearly around eight to 5 to 6 follicles they usually mature. Okay, so when like this, and they have to be monitored. Otherwise, they have to be monitored, and that is called the follicular study. Follicular study. The 11th day, 13th day, 15th day, and 16th day, we see how the follicles are growing, how good is a maturity and all. The size of the follicle when it reaches to 19 mm to 21 mm, then they go with the trigger injections like HCG, and for the ovulation to occur. Or they even advise the patient on the day of ovulation to have a normal intercourse, and thereby that cycle they can even anticipate the pregnancy. So this is one way where the USG for the follicular study is studied. And the next way of diagnosing the ovulation is the BBT, that is the basal body temperature. As the during the course of the follicular period, or we can say the proliferative phase, there will be gradual increase in the estrogen and progesterone levels. So at the time of 14th to 15th day, because of the LH surge, that is luteal hormone, and progesterone being a thermogenic hormone, there's a slight raise in the temperature, and this indicates the ovulation. So a day prior, 24 hours apart, when they are instructed for the normal intercourse, then also the conception would be normal. So like this, We also have the cervical mucus study, where the cervical mucus study, here we can see this is a cervical mucus which is taken on a glass slide, and when they are the two slides are apart, placed apart, we can see the string here. This string it tells the positive of spin Bartlett test. It is because of the increased amount of estrogen present within the mucus, because within the cervix, the discharge from the cervix. So this also tells us that the ovulation has already taken place. Hmm. And this gives us the diagnosis of ovulation. It is good, but with this we can indicate the time of ovulation also. And also the vaginal cytology here. The can see the fern pattern of the this thing, and this also shows the presence of estrogen because of the increased estrogen levels. We can see this fern pattern in the mucus test. And now coming to the tubal causes. After the ovulatory causes, it could be because, and the diseases, it could be because of PCOD, or it could be because of luteinized unruptured follicles, or it could be because of uh, um, this thing, the diminished ovarian reserve. It all contribute to infertility. Coming to the tubal causes, it's mainly because of the pelvic inflammatory diseases. Whenever the PID is persisting, or a dull aching pain is persistent in a woman with abnormal vaginal discharge, that hints towards some abnormality within or some inflammatory condition persisting in her, and that leads to, and these inflammatory changes will is going to disturb the conceptus. So hence, whenever there is inflammatory disease, PID is persisting, there's always a chance of tubal blockage. Tubal block, or it can be either the periphery, or there can be kinking of the uterus, and mainly in conditions with tuberculosis, pelvic tuberculosis, or we can say as the Mycobacterium tuberculosis, has a more affinity towards the fallopian tube than the lungs. So that because of the infection of tuberculosis, that leads to kinking or blockage, could be because of the pelvic inflammatory disease, or even it could be because of the STDs, or STDs like syphilis, gonorrhea, or any other conditions where abnormal discharges are there, whereby uh, abnormal discharges persisting, where vagina is the only way where the organisms gain entry, the infections start sending into the uterus, and they are carried to the they are carried to the pelvis, to the tubal ostia, and thereby it would lead to the blockage, or either a partial block, or even sometimes with the cases like post-abortal conditions, where the aseptic precautions are not taken, or in cases with the illegal abortions, which will ultimately set into PID, these conditions. And also in cases with the previous ectopic pregnancy also, if one of the tube is salpingectomy, it is done. So these are important to be evaluate, or to look for, is there are there the tubes are normal or not. When the tubes are normal, and with the normal ovulation, then we go for the uterus, whether the uterus is normal or not, whether the is it having um, any abnormality or congenital abnormality of the uterus, or is it with any lesions, if at all, like uterine fibroids or tubo-ovarian masses, if sometimes, or the most dreadful condition of all, that is the endometriosis, that is the lodging of the innermost layer of the uterus, the endometrium, outside the cavity, which is the most dreadful and which leads to infertility, endometriosis, that needs to be evaluated, that is the endometriosis, fibroids. And coming to the poor cervical mucus quality, or with the infections. When we talk on infections, infections could be because of trichomonas, bacterial vaginosis, moniliasis, candidiasis, depending on the organism or the bacteria, viral infection. Any infection within the uterus or within the genital tract will definitely pose threat in the conception, which leads to infertility. So these are the slides. And now coming to the investigations, how to detect, how to diagnose with the tubal factors. What are the other investigations which are there? There is a dilatation and insufflation test. HSG, that is the histosalpingogram. This histosalpingogram is widely used than the laparoscopy and the chromoperturbation. And this laparoscopy and the chromoperturbation is said to be the gold standard investigation, whereby we can rule out almost all the factors which is leading to infertility. Thereby, we can look on the tubal factors by locating any blockage, if at all it's persisting or not, or we can even see the any we can even see the ovaries, the nature of ovaries. Is it a polycystic or if it is a normal thing, or even uh, so, and even the pelvis, if there are any adhesions persisting in the like if there are any adhesions because of the endometriomas or endometriosis, they can be done lysis, adhesiolysis, because once this laparoscopy is done, so it almost all the factors can be looked for, and hence it is called a gold standard investigation or gold standard to for the infertility profile diagnosis. And others are the sonohystosalpingogram, falloposcopy, and salpingoscopy, whereby we see the integrity, or we can see the how is the uh, tubal integrity, whether it is normal or not. All that can be detected through these investigations. HST, that is the histosalpingogram, and it poses a little threat to the as it is x-rays are radiations, because of radiations, uh, poses little threat when compared to the laparoscopy. But this laparoscopy cannot be repeated every time, because this in order to adhesiolize in cases of endometrioma, repeatedly undergoing this laparoscopy f- also is a threat, because repeatedly when it is performed again and again, the adhesions become more and more dense. This is the pic of the endometriosis, where we can say this the innermost layer of the uterus, that is the endometrium, is is lodged other than the normal side. It can be lodged in the uterus, it can be lodged in the ovaries, because it has ovarian endometrioma, or endometrioma, chocolate cyst, or it could be lodged in the fallopian tube. Anyway, the round ligament, depending on the this thing. So these are certain investigations, and also the causes which leads to infertility. Okay, we are done with the congenital uterine anomalies, fibroids, endometriosis, and cervical mucus quantity, and the infections. And coming to the cervical factors is the postcoital test. Postcoital test is one of the factor which tells us about the anti-sperm antibodies, or the presence of anti-sperm antibodies which are seen, or whether the cervical secretion becomes a hostile, that can be ascertained with the PCT. And coming to the pathophysiology, or we can say that how it leads to vandhya. Hmm? It is mainly because of the mode of life that leads to vega dharana. All these, that is uh, when the because of vega dharana and uh, And there will be vitiation of dosha, mainly the vata dosha that takes shelter in the yoni roga, and that leads to the vandhya. And because of these inappropriate lifestyle and vegatharana, and when this when this semen is not highly lodged inside the inside the vagina, that because in case with the samirana nadi, when it is falls over samirana nadi, which is outside the vagina, and where improper deposition of semen in the vagina will also lead to vandhya. And there are manasika uh, uh, this thing temperament, mental temperament also pose a problem when it is pose a problem with the infertility, that is shokata, kridda, bhita, vimana. If the person is more of tensed, emotional, and when the temperament is too high, in such people there will be increased rajoguna that leads to vata vitiation, and thereby it leads to the vandhyatva. And hence saumanasyam garbhadharanam is the final quote that needs to be understood, because saumanasyam, when the tranquility with all the bodily mental uh, uh, is acquired, only then the conception takes place. And also we can see with the yoni rogas, like I just told you, with all the yoni vyapas, when they are not treated, will ultimately lead to bandhya. And now coming to the chikitsa aspect, the chikitsa aspect mainly falls on the samanya chikitsa and the vishesha chikitsa. In the samanya chikitsa, we have shodhana and the shamana chikitsa. And the vishesha chikitsa here includes the uttaravasti and the certain what we say sthanika chikitsa also. Excuse me. So, for the chikitsa, sankshepatha kriya yoga nidana parivachana. So, removal of the causative factor is the first line of treatment. This is most important line, whereby the women these days are more towards the fast pace of life, where the women have no time for the proper food, no time for the family, or where they are so busy with each other. The couple, they become so busy with each other is one of the most important thing that leads to differences in them, and ultimately it leads to the infertility. So it mainly falls on Shodhana Chikitsa, Shamana Chikitsa, Pitta Chikitsa, and Basti for Vata Shamana. Excuse me. So here, Shodhana, mainly it is told like Sneha Sweda, Vamana Virechana, Asthapana Anuvasane, Kramashah, Upachare, Madhura Oshada Siddhabhyam, Kshiram Krita Srishta Purusham. So the husband should take the Kshira Krita Ahara. He should take Striya Taila Mansabhyam Ityeke. Mainly, the woman is advised to take Taila and Masha. As Arthava being Agneya. So this is being advised. So after the proper Shodhana with the Sneha Svedanadi Vamana Virechana Astapana Basti karmas, then the after proper Samsarjana karma and following the Kshira and Grita ahara, Pushti ahara for Purusha and Stri to indulge in Taila and Masha is ideal patya for the couples. So, so it is divided into Sarvadehika and Sthanika. It is the same I just told. And Sthanika chikitsas like Yoni Prachalana, Yoni Pichu, in cases with that helps to build a healthy condition of genital tract, which is need for dilatation. Like in cases in conditions like ASA, that is anti-sperm antibodies, if at all it is present. In such patients, we can go with the Yoni Pichu, with the Falakrita, or we can go with the Kalyanika Krita, or with the or if there is any Karini or cervicitis like conditions, we can go with the Tutta, or the Kshara. Tutta is one of the Kshara. That it can be whereby the cervical erosion can be corrected. Cervical erosion can be tackled well, so that the normal granulation tissue starts growing. and hence this Thanika Chikitsa has got equally importance in treating the infertility. Coming to the Shamana Chikitsa, the use of medicated Ghrita and Thaila. LikeGhritas, certain Thailas for the ovulation induction, we do give with we do start with the uh, Jirakadi Thaila, or even certain Swarnakshiri Pana is given for the proper ovulation induction on the third day or fourth in alternate days, and so that the uh, the oocyte starts the graphene, we get a good size and the quality of the ovum, the graphene follicle, and then the ovum with a good quality of the ovum through Ayurvedic perspective. So the use of even Falakrita has shown uh, good results in the oocyte, the healthy oocyte for the proper health, growth and healthy oocyte. So these preparations are used as balya and also to gain physiological strength in her. And the same, there is Pitta Chikitsa, I just told regarding the ovulation, that is with the Chitrakadivati, where as Arthava is Agneya, so the preparation should be such that it increases the Agnivardhaka guna in the body, and thereby the formation of oocyte is well enhanced, is properly formed. So and the use and this preparation are used to induce proper rutukala, that is the ovulation. So such dravyas are like swarnakshiri pana, and the use of Jirakadi Taila, or the use of Pushpa Dhanvarasa on the second day of the cycle, whereby a controlled manner of ovulation induction can be seen, but without the hyperstimulation of ovaries, what we see in the modern panels, that can be avoided with the use of proper and regulated dose of Ayurvedic preparations. And next is the basti. The for the basti here we do have we do give with the anuvasana with the falakrita or shatavari krita, kashmiri adi krita, or even shatavari tela, narayana tela, shatapushpa tela is advised for nasya in conditions with arthava, in cases of oligomenorrhea conditions, or even in case of kashtarthava, and lashuna taila for basti, and bala taila, which is the best vatahara. So entirely for treating this yoni vyapat, uh, first we have to correct the vata. Nahi vatatrite yoni narinam sampradeshate. Without the vitiation of vata, there is no yoni vyapat which affects the women. And hence, shamayitva tamanyasya kutya doshasya beshajam. So first you treat the vata dosha, and then you tackle with the other dosha. Uh, is the what we say motto of treating the infertile couple or with the any yoni vyapats. So to conclude, female infertility has been explained in detail in Ayurvedic classics. So panchakarma is the treatment of choice and considered the best at the preconceptionally. Thank you. So with this, we conclude my topic. Though it is too vast and it's hard to complete in 1 hour, so I have made my best to cover at least. I hope it is helpful. Thank you. Thank you, Dr. Sri Lakshmi, Napsi, Nagarcoil.
Okay. Thank you so much, Dr. Supriya, for spending your valuable time with us today. I hope this video will be useful to our final year students and all BMS, first year, second year also. And you have said very beautifully what are the causative factors we have to look for, and we have to take first menstrual history, and next examinations, what you have to look for. According to the factors, we have to go for the thorough examination in the local examination, and the investigations also you explained very beautifully, and the chikitsa also, sthanika chikitsa you said, and you said everything in detail. There is no secrets with you till now in treating the patients. So openly you said all the treatment, and in future we will be expecting some more videos from you like this, so our viewers, our doctors will get more benefit out of it. And our in ayurveda, our gunshot treatment for this infertility is Uttaravasti. I think so.
Yeah. Yes, yes.
Okay. Thank you once again.
Thank you. Thank you. Thanks again.
If you are
Any
having any
queries?
questions,
Huh.
please contact me. So I will forward doctor number to you. Thank you.